My name is Isabel Ureta, and I will be presenting on the software company Epic Systems and their impact on the technological progression of electronic health records. So what is Epic Systems? Epic Systems is a healthcare software company that is popularly known for its electronic health record software. Epic Systems products are used by more than 250 healthcare organizations nationwide. Let's discuss the history behind Epic Systems. Epic Systems is one of the most well-known names in the world of health IT. Epic Systems was founded in 1979 in a basement by Judy Faulkner, who is a programmer and now the company's CEO. Faulkner was able to kickstart her company with a $70,000 investment from family and friends, and as of 2016, the company has earned a revenue of $2.5 billion. The company was originally named Human Services Computing, but it was then rebranded as Epic Systems in 1983. Epic Systems is headquartered in Verona, Wisconsin, and this year there are about 9,800 people employed at Epic Systems. Epic Systems campus is also very unique. Architects from Disneyland were hired to design Epic Systems headquarters. The campus has many themes ranging from farming to NYC's Grand Central Station to natural outdoorsy settings. Epic Systems is most known for their electronic health record software. So, what is an electronic health record? An electronic health record is a patient's electronically stored medical history and information that can be retrieved and reviewed by healthcare providers, nurses, and many other healthcare professionals. EHRs are essentially a digital version of a patient's paper chart. They contain a patient's medical history, diagnoses, medications, treatment plans, immunization dates, allergies, radiology images, laboratory and test results. You can see some of this information in this screenshot of an electronic health record. For instance, if a nurse were to look at this EHR, he or she can take a look at their patient's vital signs, such as heart rate, respiratory rate, blood pressure, etc., and know which medications are scheduled for him or her to administer to the patient. An important feature of EHRs are that they can share information with other healthcare providers and organizations, such as laboratories, specialists, medical imaging facilities, pharmacies, emergency facilities, and school and workplace settings. The patient's EHR holds information from all physicians involved in his or her care. Electronic healthcare records allows users to retrieve and input information instantly and securely. This information is available at any time, which promotes improved patient care, increased patient participation, and improved diagnostics and patient outcomes. This method of charting is much more efficient, organized, and less time-consuming than writing it all down on paper. And this is why EHRs have become very important in healthcare. Now, I will be going over Epic Systems' electronic health record software called Epic Care. To date, 45% of the U.S. population have their medical records in an Epic system, and Epic states that 190 million people across the world use its technology. Epic Care is mainly used by physicians and organizations, and the majority have noted that the software is fairly easy to use. The data model used for Epic Care is ran through a data management system called Chronicles. Chronicles follows a process called ETL, which stands for extract, transform, and load. In this process, data is extracted, transformed to fit the relational database, and is then loaded into the database tables. Once the data is loaded, it can be used as a data source for a report that is seen on an EHR. Epic Care is designed for large hospitals in 50 to 100 healthcare fields and specialties. Many hospitals opt for Epic Systems software because it provides real-time data for patients, providers, and outside parties. As I have previously mentioned, information in an Epic system is easily accessible. Epic Systems services are supported through devices such as Windows, iPhone or iPad, Mac, and it is also web-based. It is also important to mention that storing medical information electronically is secure because it is known as a sensitive document, so only those who need a patient's information are allowed access. Healthcare facilities also avoid losing medical documents related to misplacement, theft, or destruction. The pricing model for Epic Care is subscription-based. This subscription follows a monthly billing schedule per user, plus upfront costs or license fee for software ownership. There are also extra fees and costs for additional features and modules. There is also a maintenance cost, installation cost, customization cost, data migration cost, and renewal cost. I will now discuss how Epic Care is implemented in a healthcare setting. Epic Care is used in community hospitals, retail clinics, rehabilitation centers, independent practices, and academic medical centers. Epic software is installed into computers used at any healthcare setting. I currently have a clinical at a community hospital, and I have seen physicians and nurses use Epic Care while working. Nurses and physicians sit down at the nurses' station and use Epic Care to do their patient charting. I also see them using the software on laptops on medical cart workstations. Nurses usually use these workstations when going from room to room. It makes it much easier for them to input their patient's medical information while they're on the go. Nurses have also told me that they like how organized and detailed Epic Care is, and it makes their charting process go smoothly. The implementation of Epic Care into many hospitals has allowed healthcare providers to access, organize, store, and share electronic health records efficiently. Apart from Epic Care, Epic Systems has many other products and services that healthcare facilities can utilize. The first and most important of the products listed is MyChart. MyChart provides patient engagement features, thus enabling patients to have access to their health records on their computers. Next is Healthy Planet. Healthy Planet uses data interoperability to boost population health management efforts. It is born out of the Affordable Health Care Act and is related to accountable care organizations. Revenue cycle management helps handle patient claims and billings. This includes paperless/online bill pay, self-service payment plans, financial assistance, and more. Tapestry addresses managed care activities and provides integrated insurance operations support. Lastly, mobile interfaces aid patient care via mobile device. Epic has developed 3 apps for patients to use. Patients can use Epic Haiku on phones, Epic Canto on tablets, and Epic Limerick on Apple Watches. Although Epic Systems software is highly advanced and renowned in the medical field, there are some major criticisms that its users have vocalized. The first criticism is that the product costs are high, especially Epic Care. Although Epic Care has been designed for larger hospitals and is a high-quality program, its prices can be expensive. The subscription alone can cost $1,000 a month, along with the many other costs and fees that come with software ownership. The next major criticism is that there is a lack of interoperability with other vendors' products. There is only Epic-to-Epic interoperability. This is an issue because the inability of obtaining a patient's records from one facility to another makes patient care difficult if an outside party does not use Epic software. The last criticism is that some users find that navigating through the software can be difficult. I have witnessed nurses complain about the amount of clicking and searching they have to do in order to find what they're looking for in Epic Care. There are also users that are unfamiliar with technology, so using Epic Care can be confusing for them as well. To conclude this presentation, I will talk about Epic Systems' impact on healthcare and how its software can be improved. Epic System has changed the game in healthcare because its advanced EHR software has proven to be very beneficial to physicians, nurses, other healthcare professionals, and patients. The technology behind Epic Care's data management system has improved patient care for providers and their patients. Their software allows strong communication with patients and healthcare providers through the MyChart feature, and patients are also able to review their medical information. These factors combined have improved patient experience greatly. There are some improvements that Epic Systems can implement in their development and upgrading of products. Epic Systems should find better ways to make training easier for those unfamiliar with technology. At my clinical, I saw that nurses were provided manuals on how to use the software, but I think that something more interactive and engaging, like a seminar or an online training program, could be more effective. Epic Systems should also work on their interoperability with other vendors' products to make it more convenient for healthcare facilities to obtain a patient's medical information and advance the delivery of healthcare. Lastly, Epic Systems should alter their prices for smaller independent practices that want similar software compared to larger hospitals. They could design software that is suitable for smaller facilities, thus decreasing the cost. Here is a list of the references and sources that I used for this presentation.